Hello, my name is Andrew Smith. I'm a hand and wrist surgeon in East Kent. I was appointed as a consultant 15 years ago, and I work in both private practice and the National Health Service. Most people that present with trigger finger or trigger thumb present with a clicking or locking sensation in the digit affected, where it will stick into the palm and is painful to flick or force out to get back to the normal position. That's the typical presentation, but sometimes people present with a stiff finger. They present with just the catching or locking, which is not particularly painful, but clearly quite inconvenient. And sometimes they have a combination of both of those things. So trigger finger or trigger thumb is caused by an inflammation in the tendon sheath, which causes a degree of narrowing, and in response to that the tendon will swell a little. So there's a mechanical locking situation that occurs when the tendon tries to glide through the sheath, and that's why it sticks or locks, and it's also why it's painful. Trigger finger or trigger thumb is diagnosed purely on the patient's history. They'll clearly describe the finger locking, and the examination will reveal that, and also a degree of tenderness around the mouth of the sheath in the palm of the hand. In the very early stages, some trigger finger or trigger thumb will get better by itself or with a combination of non-steroidal anti-inflammatory medication. If that fails to get the situation to settle, then approximately 90% of patients will find good relief from a steroid injection. That can be either one, which is successful in probably 80% of cases. If that doesn't work after a period of 4, 5 or 6 weeks, then it's worthwhile repeating that steroid injection, as in total about 90% of people will be relieved of their symptoms without recourse to surgery. If surgery is required, it's carried out under local anaesthetic and is a very short procedure and is usually very effective. If you have a problem with what you think may be trigger finger, then it's worthwhile getting that checked out, because it's a very easy situation to resolve, and that can either be done through a referral from your GP or directly through a referral to a hand and wrist clinic at the One.